أستغفر الله أستغفر الله أستغفر الله الله.
Here is a parathyroid. Parathyroid glands are very small. They only weigh about, let's say 25 milligrams. As you can see, often, and certainly in this case, half of this is fat as well. The parathyroid gland produces one hormone called parathyroid hormone. It has exactly the opposite effect of calcitonin from the thyroid. So whereas calcitonin takes calcium and puts it back into bone, parathyroid hormone takes calcium from bone and puts it into the blood. And that's why proliferations of parathyroid tissue, like hyperplasias due to various causes, or benign tumors, which they almost always are, produce hypercalcemia. Parathyroid disease is usually picked up by screening for blood chemistries and finding elevated calciums in people that have no other reason to have elevated calciums. The parathyroid gland, besides having a nice fibrous capsule, which you can see here, and a little bit of fibrous tissue like you see here, and fat and blood vessels, has two kinds of cells. The cells that you see chiefly are called chief cells. And all of these cells here, which look, like endocrine cells, perhaps sometimes looking like they form little follicles, but the chief cell of the parathyroid is the chief cell. The second most common type of cell, which is considerably less than the chief cells, are these red cells. They are called oxyphil cells. So the chief cells and the oxyphil cells are the active cells of the parathyroid. And I believe that the chief cells are even more active, but don't bet your life on it. Here's a nice good sized vein. Here's an artery. Here's another vein. Here's fat. Here's chief cells. There might be a couple little oxyphil cells scattered here and here and here and here and maybe here. Here's might be a remnant of a capsule, and here's the largest group of oxyphil cells that you see in this particular gland. And let's zoom in on it, a couple more pops, and we'll see that clearly the oxyphil cells stand out like a sore thumb, because they are very red. They have a lot more cytoplasm, and otherwise the nuclei of the oxyphil cells look a lot like the nuclei of the chief cells. But the oxyphil cells have much more cytoplasm, and the cytoplasm is much redder. So all of these critters here are oxyphil, 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 oxyphil. And all of these guys, and we're at the highest power, looking a little bit more boring, are the chief cells. Notice also something I really should have pointed out about thyroid or endocrine in general, is that the endocrine tissue in your body can have considerable nuclear variation. You can have really, really big, dark-looking cells, which the neophyte might say, hey, are these nuclei malignant? Atypical, dark, irregular, bumpy nuclei are very, very common in all normal endocrine tissue. So let's forget about the pathology and just say this is the world's most classical parathyroid gland, having a lot of oxyphil cells here, and a lot of chief cells here, and a few chief cells here, and a few oxyphil cells here. And there's really nothing I want to say except thank you.
هاتنا واللي كفا ولنعاود من قريب ولنعد للنور صفا عهد ماضينا الأريب يا عسى الرحمن يهدي كل صبار منيب ويعيد الحب ينجي بالهدى قلب الحبيب عسى الرحمن يهدي كل صبار